We're so fortunate to have Dr. Crain Garrot. Dr. Garrot is a board certified medical oncologist and hematologist with Georgia Cancer Specialist, and he's on the board at Northside Hospital Cancer Institute. And we are talking about genital and urinary and prostate cancer today. And we're taking your calls at 404-872-0750. That's 404-872-750. So, if you have a family history of prostate cancer, if you're having some symptoms with your prostate, some enlargement of the prostate, problems voiding, give us a call, 404-872-0750. Dr. Garrot, we're going back to the phone lines and speak with Mike and Conyers. Good morning, Mike. How are you?
Good morning.
How can we help you today?
Well, as I indicated earlier, I had a PSA on an annual physical. It was slightly elevated from the last one. He recommended me to go to a urologist, which I did. They did that delightful DRE and said it was enlarged. He recommended an MRI where they found a small lesion, and now I'm going for the Gleason test this Friday. And my questions were, what could I expect during the procedure and any kind of pain after the procedure? And about how long did it take to get those test results?
Okay. So just to talk about your MRI, that has actually now become a very common test to help a urologist to determine if the PSA and the exam is more or less likely to be cancer. And so what has happened to you is extremely common. And so just for other men, if you are offered an MRI to look at the prostate, that is really used ubiquitously now. And so that's spot on. And then, so the procedure you're going to have is called a transrectal ultrasound. I'm sort of thinking of the most common things. I don't know if you have any variation of that, but the transrectal ultrasound is where they do an ultrasound probe into the anorectal area, because the prostate is very, very close to the rectum. And so you can actually, that's how you feel it through the digital rectal examination, and you can image it through the rectal area. And then there's a biopsy that goes with that. And doing that biopsy, there's usually 6 biopsies on each side of the prostate. And the prostate is not a big gland. It's about as big as a walnut, maybe like a golf ball. So, 6 biopsies on each side is pretty comprehensive to assess that. Then usually they will try to do what's called a lesional biopsy, meaning that if there is a lesion on the MRI, they'll go for that and try to target that one, because that's the hot spot of concern. You see what I mean? So now what a man usually experiences is some discomfort during the test. I am not aware of whether they sedate you or not. It seems like you should be sedated. So that's a question to ask your provider team. And but then afterwards, a man goes home the same day. Most men will have some discomfort for that day. There can be some blood in the urine, or potentially in future ejaculate. But very rarely a man can have some infection. There's been known cases of men who can develop a sepsis-like syndrome from it. That's rare, but it can occur. I've heard it's like 1 in 1,000. I'm not sure if that's the right number or not. But nonetheless, most men go through that. It's a couple of days of uncomfortableness, and then they recover pretty uneventfully. But the rare man will have some more significant problems. So, but then the results will come back. The biopsies are usually back within 5 to 7 days. Most men will see their urologist after 1 or 2 weeks, and then go over the results, and then determine, is it cancer? Is it, something we have to do? And then a plan will be made for treatment, or even for some men, active surveillance.